So here you can see Crestor, Zocor, Mevacor, Lescol, Pravastatin. All the statins have Zetia, Niaspam. They all have the same thing. Before starting therapy with these, you're supposed to rule out secondary causes. And the biggest missed secondary cause is low thyroid. So your doctor, typically, we check a few of these things, and most of them are missed. For years when I practiced, before I did holistic, I checked these blood tests. They were normal. I started the person on the statin. Since then, over 95% of all the patients that come to me on statins were able to find the cause and get them off. So here's another little joke. So the earth is flat was the original idea. The earth is round was the new idea. Didn't go too well for him. The earth is the center of the universe. Of course, the sun is the center of the universe. Galileo also did not go too well. So it's a history of new ideas being rejected initially, and this is sort of how it is. It's also $10 billion in statin sales. So again, remember the 5 things: toxins, hormones, diet, exercise, and your head. So again, the 2 most common parts that are missed are hormones and toxins. So thyroid's the main thing. Back in the 1920s, it was known that thyroid, if you had high cholesterol, you were probably low thyroid. And before we even had thyroid tests, we would diagnose low thyroid by using high cholesterol levels. That sort of got lost. And there's a direct link between thyroid regulation and cholesterol metabolism. So here's like the big landmark study where they found the exact DNA regulation of thyroid hormone and cholesterol metabolism. So there's a direct link. We know what DNA it is, and so there shouldn't be any doubt. So this is a favorite book of mine. So people still have low thyroid, have normal blood tests, and high cholesterol still. So what's wrong? So 2 things. One, when there's an error, there's 2 errors in the normal thyroid level. So TSH is the typical one they check. TSH is the hormone your brain releases to tell your thyroid how fast to work. And to T4. So T4 in the blood, our body actually uses T3. So if you measure T4 and TSH, those can both be normal, but you can have low levels within the cells. That's why it can look normal. So we have type 1 and type 2. There's a list of symptoms it can cause. I usually give patients a 3-page handout of all the things it can do. The biggest one is what I call wired and tired, where people feel exhausted but anxious. Chronic fatigue, cold, obese or thin. So type 1, you're obese. Type 2, you're thin. Hair loss, anxiety, depression, diabetes, allergies, osteoporosis, reflux, and 127 other symptoms. Thyroid is the master gland. So how can you check if you think you might have it? Or sort of 2 things you can do. One is check your temperature as soon as you get up in the morning. It should be over 98. If it's low, there's a good chance you're what's called type 2 hypothyroid. The second things we test, so we do use the blood test, knowing the optimal levels are within the top 10%. We do an iodine skin test. Iodine should last more than 24 hours on your skin if you put a drop on it. Like I said, your temperature. Then metabolism, we have 2 of these. If anyone wants to be tested after the talk, we'll be happy to show you. This will check your metabolism, percent body fat, skeletal muscle mass, and a couple other things. And you just stand on it. Symptoms, of course, and what I call the anaerobic threshold. As you walk on a treadmill, there's a point where your body switches from aerobic to anaerobic. And that's a marker of also how your thyroid's working. So how do we treat it? A lot of natural things. Iodoral is a type of iodine preparation. Most people we've measured so far are low in iodine. MedCap T3 is a selenium-based product that allows absorption of thyroid into the cells. T150 is an extract of thyroid and adrenal. Beyond Chelation Improved is sort of a super multivitamin that's pretty cheap and easy to take in one little packet. Armour Thyroid is a natural thyroid. Typically, patients are prescribed Synthroid, which is synthetic thyroid, which is only 85% similar to us. And Armour has T1, T2, T3, and T4, which is all the Ts. Adrenal support, you have to have enough cortisol to be able to metabolize thyroid. Licorice, which has an enzyme that blocks the degradation of cortisol. And vitamin C, which is the main building block for your adrenals. Your adrenals have the highest levels of vitamin C in the body. So here's another book, Stop the Thyroid Madness. A patient was misdiagnosed for years, and because she got better, she started this whole movement. And hormones. So what makes you a man or a woman? Estrogen, progesterone, testosterone is, if you think of a three-legged chair, that's one. Cortisol is your stress hormone, and then thyroid. Those are sort of the three you have to have in balance for health. So here's the pathway. As you can see, from cholesterol is the original building block. If you block that first step right there with a statin, you cut off all those other hormones. So it's sort of a chemical castration. So you can see cortisol, estradiol, estrone, DHEA, progesterone. If your cortisol is low on the top right there, then all these other get pulled to maintain cortisol. Your body will lower the levels of all your other hormones to maintain cortisol to keep you alive. So cortisol is a stress hormone, and then, like I was saying, sex hormones. So here's one of the first studies I saw where they balanced, replaced hormones lost to aging, and they had 100% improvement in patients' cholesterol. So again, sort of the typical symptoms you can have, and how their before and after replacement, how the cholesterol went from 266 to 166 just with hormone replacement therapy.
The HDL went down.
The whole thing of good cholesterol and bad cholesterol is not really, they're both good actually. So this is actually our study. So we took the first 90 patients, looking at how they responded to what we did. So again, and a couple of sort of reference facts from it, that cholesterol levels rise in response to toxins. 100% of patients studied by the EPA had toxins present. 100% of the first 90 patients we checked had either lead, mercury, or both. Mercury's been shown to increase risk of heart attacks, atherosclerosis. You're talking about the teeth fillings, of course. Lead is definitely toxic. There's also, as your immune system is lowered, there's a increase. You always have yeast in your gut, but there's an increased amount of yeast, so you'll start seeing it in the nails, and it's actually all over the system. That also damages arteries. So again, sort of putting it all together, you get cholesterol, toxins, and hormones, sort of all linked together. As you treat all three, you definitely see improvement. Again, here's more studies showing the link. So here's how, when we measure for toxins, we give you a chelating agent. You then collect urine for 6 hours or 24 hours. And here's how the report usually looks, looking for the 20 most common toxins. You can see lead and mercury in the middle. Nickel, this person had nickel, and a little tin, and a little arsenic. So it's a very typical sort of pattern we see here in South Florida. So detoxification is key. Originally we were doing IV chelation, now we're doing mostly oral, and that's a lot easier than surgery over there on the side. So toxins actually, how does toxins cause damage? Toxins cause damage along the cellular walls. Cholesterol is actually the body's healing mechanism. So plaque is like a callus that you have like on your hands, and plaque builds up with calcium deposits.